Here's today's MercyOne Genesis Medical Moments.
We are continuing our conversation about breast cancer awareness with Dr. Simmi Fain, a radiologist here at MercyOne Genesis. So, doctor, some women find out that they have dense breasts after having a mammogram. What does that mean? And can you still spot cancer with just a mammogram?
So whenever you get your mammogram report, it's going to tell you the density of your breast. And breasts are made of normal fat and what we call breast tissue. And every woman's body's different, right? Some women are going to have fattier breasts, some women are going to have the denser breasts. The issue with dense breasts is that they can make cancer a little bit harder to see. The cancers can hide in them. At MercyOne Genesis, all our mammograms are what we call 3D mammograms. So that means we take multiple pictures, sort of little slices through the breast that help us see through the dense breast tissue, and that's the most accurate form of doing a mammogram.
Okay, so how exactly does 3D mammography work? And is it just for those who have dense breasts?
So basically, it's very similar to like a CT scan, where instead of just taking one 2D picture of the breast, it takes multiple 3D pictures of the breast, and it's a very low radiation dose that's safe, proven safe for women to get once a year. And it's not just for women with dense breast tissue. We recommend all women have 3D mammography, and in fact, all of our mammogram machines at MercyOne Genesis are 3D mammography.
Okay, so if a patient discovers they do have breast cancer, what are their treatment options? What's available?
Yes. Typically, breast cancer is treated with a combination of surgery and radiation to the breast afterwards. Not all breast cancers require chemotherapy these days, and some breast cancers respond to something called hormone therapy very well. So there are different treatment options out there, and we kind of just cross that bridge when we get to it and make an individual plan with each patient.
Yeah, because everyone's different. Every body is different, right?
Yes.
Okay, so patients sometimes, they have a hard time understanding those results when they get those in the mail. How does MercyOne, make things easier when it comes to explaining and teaching about those results?
So when we're in our breast cancer clinic, if you have any abnormal results, those are explained to you in person by a specialized technologist whose only job is breast imaging. And then if you ever have an abnormal diagnosis, a physician, a radiologist will actually explain those results to you as well, either in person or over the phone with the biopsy results. We never leave women out in the cold wondering what's going on.
Okay, so talk to us about the process of getting a mammogram. Exactly how long does it take?
Yes, so once you're scheduled for a mammogram, you come into one of our lovely mammogram facilities, and there's usually a private waiting room for patients. Again, one of those highly specialized technologies will walk you through the exam. It's a few pictures of each breast, and it only takes a couple of minutes to do. Afterwards, your exam is read by a radiologist, which is a doctor who specializes in breast imaging.
And as far as scheduling a mammogram, how easy is that?
Well, there's a few different ways to go about it. Number one, you can always ask your primary care, your general physician, to help you get scheduled for one. Number two, if you prefer to get yourself scheduled online, you can easily do that at MercyOne.org. And number three, you can always call 421 X-ray, and our schedulers are happy to help you get scheduled.
All right, simple as that then. Some great information you provided with us today. Thank you so much, doctor, for taking the time to talk to us.
Thank you for having me.
And this was your MercyOne Genesis Medical Moments. And for more information, go to ourquadcities.com and click on the medical tab.